The Karnataka government has implemented new measures to safeguard its citizens in response to the recent surge in Covid-19 cases in neighbouring Kerala and the identification of a new subvariant of the virus. Karnataka Health Minister Dinesh Gundurao, in a press conference held in Madikeri on Monday, announced that face masks are now mandatory for individuals above 60 years of age and those with comorbidities. Moreover, individuals exhibiting symptoms such as fever, cold and cough are also required to wear masks compulsorily. Minister Gundurao highlighted that this decision is part of the state's proactive efforts to protect the most vulnerable population from the virus. Concerns were raised about potential restrictions on Sabarimala pilgrims returning from Kerala. However, Minister Gundurao clarified that as of now, no movement or gathering restrictions are in place. He stated that monitoring will continue in districts bordering Kerala, including Chamarajanagar, Kodagu and Dakshina Kannada. The minister added that tourists and devotees, especially those travelling to Sabarimala from the state, have been cautioned. Minister Gundurao announced that an official order mandating the wearing of face masks along with other guidelines will be issued after a meeting with the Technical Advisory Committee on Covid-19 on Tuesday. The committee, led by Dr. K. Ravi, head of the Department of Medicine at Bangalore Medical College and Research Institute, is expected to provide additional guidelines on safeguards. Over the last 3 months, Karnataka has reported 58 active Covid-19 cases, with 11 individuals hospitalized and 1 Covid-related death. Minister Gundurao reassured the public that there is no immediate cause for concern. He informed of 1 death due to Covid-19, but the person also had comorbidities. Gundurao stressed the importance of preparedness and learning from past experiences. To enhance the state's readiness, the Health Department has ordered 3 lakh medical kits, PPE kits, and an increased number of rapid antigen tests or RAT, particularly in regions bordering Kerala and the state capital of Bengaluru. Currently, mock drills are underway at all government hospitals to assess the preparedness of medical infrastructure in handling potential emergencies. These drills encompass bed availability, staff readiness, oxygen plant functionality, and essential medical supplies. Minister Gundurao ruled out the imposition of any movement restrictions at this stage, but emphasized the need for stringent monitoring to ensure the safety and well-being of the citizens of Karnataka.
The only thing is, because number of cases have increased there, and Karnataka as of now today and in the entire state, as per our records, we have about 58 active cases, and in that 11 are hospitalized and remaining are at home. And so far the last 3 months we have had 1 death due to COVID, but also they had other comorbidities. So the person who died had a lot of other issues, but also he had COVID. So that is one thing. But otherwise, we have already, taking precautionary measures. We have told to increase testing in all the hospitals and health centers. Who was coming with the symptoms of cough and flu and other COVID-like symptoms, respiratory infections, whatever that is there. For all of them to start testing for COVID. So RT-PCR kits, we need to get more. So we have already started the purchase for getting more RT-PCR kits and rapid antigen tests, all those kits that are necessary. We have some in stock, but we will be requiring more. So we will ramp up testing. Then through that we will come to know whether the infections are there or on the rise or not. Post that, then we can take a decision. No, right now I don't think we should panic and start checking at the border areas or stopping movement. That is not required. But we will keep an extra vigil on those border area hospitals and nursing, our hospital health centers, to do more testing there in particular, so that we can pick up any early rise in cases. And also we have done a mock drill in all our hospitals and health centers on the availability of ICU beds, reserved some for in case if there is a breakdown of COVID, then we need to have enough ICU beds, enough oxygen, enough all the other drugs that are required, consumables. All those things we have told them to keep in stock and keep everything available. So there should not be any lack of ventilators or oxygen or anything. Spoken to the chairman of the Technical Advisory Committee. So earlier we had thought that we will fix the meeting for because they are out of station, but they will be doing it today itself. online. They'll be sitting and discussing all those things, and tomorrow whatever the technical advisory committee recommends, that direction also will be issuing it. Maybe by tomorrow we should issue the directions, or maybe today itself.
Subscribe to Oneindia channel and never miss an update.